Hello, can all of you hear me? There is a small chat box on the left hand side. You can type there if you all can hear me. Is my voice audible, well and clear? Okay. Others? Good morning, everyone. Can all of you hear me? Is my voice audible? There is a small chat box on the left hand side for the people who have just logged in. You can type there and let me know if everything is okay, and we'll go ahead with the session. Okay, great. So now this is how a class looks like. Okay, I will be the one who will be talking, and as there are a number of students, we will always make sure that there isn't much chaos in the lecture. So the students will not be given any allowed to speak or a webcam or whatever. You can do a chat. However, when we'll be doing real DTP case scenarios where we will have want the students to speak as well while they are taking a history or doing a presentation, that time we'll be giving access of the speaker or the microphone to the student. Okay, so in this way there won't be much chaos as only one person would be speaking at a time. And on the right hand side you can see the presentation which says DTP PERIO. So this is your blackboard. Okay. And about the course, how the course is, how many days will it last, and how will it happen, I'll explain everything to you at the end of the session. Is that okay? So if you guys can, just give me an assurance in the chat box that you guys are there with me, you can hear by just giving a thumbs up or saying yes. I'll keep moving ahead. Okay, great. So let's begin with the perio cases. Now, like the other courses, they all discuss just the cases in about 4 or 5 days. But Danny, you can't hear me, or can you hear me, Danny? Can everyone else hear me? Is my voice audible, clear? Okay, great. Danny, can you just refresh once if you can hear me a little? Or just increase the speaker sound or the microphone sound you're using. Or you can attend the 20th September class, and I'll also be sending a recorded link of this class today. So if you are not able to hear something or there's a problem, you can always watch there. Okay. Okay. So guys, let's begin with the session. Hopefully, Danny has got the message. Okay. So now what I was saying, like other sessions, they just discuss DTP cases in a few days. And what happens is when you go back home, it really becomes a very difficult because there are so many cases. There are about 60 to 70 chief complaints. So what in this coaching, what we're going to do is first we're going to explain to you how it is done. Okay, rather than just bombarding case discussions. So like we'll be discussing everything about perio today, and then we will be doing perio cases one by one so that you actually have an idea of what's going on, because all of you are dentists, but still, some people have not been in touch since a very long time, or the UK scenario is completely different. So first we will explain to you how it's done here in this country, and then we will go ahead. Okay. So just keep saying yes or a thumbs up on the left hand side, or just a Y, so that I know that you guys are there with me. Great. So let's begin with the perio cases. Now, I hope all of you have watched the introductory video. If not, please go and have a watch at the introductory video. Today we will be talking about perio cases. So we will be talking about what are the history questions, how you have to take a history, how you need to arrive to a proper diagnosis, what investigations you need to advise, what radiographs you need to advise, and we will also be discussing the treatment plan of each of them. Guys, is there a problem in the audio? Because my internet connection shows full speed, so can all of you hear me, guys, properly? Okay, okay, that's good. Okay, great. So I'll just tell him to refresh. So let's go ahead. Now, I hope all of you have got the notes, which are just a part of the sample notes, and you will be getting the full notes in case and if you join us. Okay, so like when you enter the main room, okay, that is how actually a DTP exam occurs. You're first taken to a main room, and there you're given a paper. The nurse gives you a paper, and the nurse will tell you, or the sorry, the paper will tell you that a female patient complains of bleeding gums, or a male patient complains of sensitivity of teeth. That's it. You will not be given any more information. So this will help you know the sex of the patient. So you will know that whether you need to include the female questions like the contraceptive pills or the pregnancy or the menstrual cycles, whether you need to ask them or you don't need to ask them. So if it's a male, you will exclude them, or if it's an old female, you will exclude them as well. Okay. And so the complaint actually tells you that, okay, it is something related to, it can be related to perio. And what questions will you ask should pop up in your mind as soon as you see the chief complaint. The sister gives you somewhere around 5 minutes before you go inside the patient's room. Okay? Okay, guys? So at the end of the slide, just tell me okay, and I'll move ahead. Okay, great. So now coming to the main room, that is when you actually enter the patient's room, you first ask the general history. I won't be going through that. That is there in the introductory video. So you will say when you come to the chief complaint, you will say, okay, so my notes say that you have come here due to bleeding gums or sensitivity. Is that right? Or you can just ask like, what brings you today, Miss Jones or Mrs. Jones or whatever. And once she says, oh, I have a lot of bleeding gums, you can give her a sympathy by saying, I'm really very sorry to hear that. That's very, very important in a UK scenario. You have to be very sympathetic and empathetic to the patient at all points of time. Okay? Guys, you there with me? Okay, except Kera. Others can hear me properly. If you could just, give me an assurance by saying why or just yes, okay, great. And then you need to say, okay, I will help you out, but I will have to ask you a few questions regarding the same before we can treat it. Is that okay? Always take consent from the patient. Okay? Next, after you say all this and you have actually come to your history, your main chief complaint, what do you do next? Now, there is a set of questions for every chief complaint, okay, which you need to learn them. And the more you practice with us at Plan ORE or with your study partner, the more you get used to uh, asking them every time you do a case. So you start by telling when do you have a problem or since when do you have it. This tells you whether it's an acute condition or a chronic condition. Is it everywhere or in some particular place? This tells you whether it's localized or generalized. Does it bleed spontaneously or only on brushing? This tells you the severity. Has it worsened? This tells you whether it's an aggravating condition or not. Do you feel there is spacing between the teeth? Do you feel any teeth are wobbly? Do you feel your gums are shrinking? If yes, that means the patient has gingival recession. If the patient says yes, the next question which should come to your mind is, do you feel sensitivity? Because people who have gingival recession will probably have sensitivity. And why is sensitivity important, people? Because you have to treat it. You have to treat it in the immediate phase, which is an important part of DTP. When the patient goes back home, he should be happy that you have treated his pain. Okay? Do you have a foul taste? Now, probably every perio condition will have a foul taste. But if this foul taste is metallic, can anyone tell me what that can be? Anybody can tell me the diagnosis because of the metallic taste? Anna, yes, it will be your acute necrotizing ulcerative gingivitis. So as soon as the patient says, yes, I have some metal kind of taste in my mouth, you should feel your quest or your diagnosis can be ANAG. Okay, clear? Should we go ahead? Okay, great. The history continues. Now you need to ask some specific questions where you can actually diagnose what is happening or what is the reason. So did you get any dental treatment done? Which will tell you whether he has got the perio treatment done earlier as well. Family history. This will tell you if it is positive, guys, it is probably an aggressive periodontitis. Okay, in an aggressive periodontitis, it is passed through genes. So if the family history is yes, it can be an aggressive periodontitis. Then you will ask history of smoking, history of diabetes and stress. You will ask them during the chief complaint, but make sure you will note them in the specific columns. Like smoking, you will write in the social history paragraph. Diabetes, you will write in the medical history paragraph. Stress, you will again write in the social history paragraph. Okay, but you will ask it during your chief complaint only. Why is that? So that you have an idea about his perio condition, but mention it in the specific area which is given in your case sheet. Is it clear? All of you there with me? Great. Okay, so that's your bleeding gums history case. Okay, now why do you need to know this? You need to know stress, smoking, diabetes and stress, because when you will treat the patient, you also have to treat this. When you will tell the patient why perio has happened, you will tell him that smoking has aggravated it, your diabetes has aggravated it, your stress has aggravated it. You have to tell the patient the reason as well. We will talk about it in the presentation. Okay, now that's the bleeding gums history. What if the patient tells, I have sensitivity in my teeth? It can be a perio case. It can be a non-carious tooth surface loss. That is, it can be your attrition, abrasion, erosion. Right? Now, this will be taken in a separate topic or a separate lecture. Right now, we'll be talking about the sensitivity related to perio. Okay? In a non-carious tooth surface loss, there will be tooth shortening. There will be, the patient will be grinding his teeth. There won't be any bleeding gums. That will actually help you differentiate between these two. However, when it's a perio case, there will be bleeding gums. There will be gingival recession. Okay, so that's how you differentiate a sensitivity perio case and a sensitivity non-carious tooth surface loss case. So in the sensitivity, you will again ask the same questions about since when do you have it? Is it sensitivity to hot, cold, or both? Do you feel that your gums are coming down? This tells you that there is gingival recession. This tells you that it is probably a perio case. And once you know it's a perio case, then you ask all the perio questions like we asked before about the bleeding gums, about the smoking, diabetes, stress, spacing, spontaneously, non-spontaneously, everything. Okay? So though it is a perio case, it starts differently. That's it. Instead of bleeding gums, it starts with sensitivity. Is it clear? Guys, you there with me? Everyone? Okay, great. Now the third kind of complaint can be, my gums are coming down, doctor. So again, this should point you that it can be a gingival recession case and it can be a perio case. Spontaneously means, Amal, bleeding is happening all the time without any stimuli. It just keeps bleeding all day. Non-spontaneously means it bleeds only when you brush your teeth. Okay? So if it bleeds spontaneously, that is, it's bleeding all the time, that means that it is a very severe condition. It is probably periodontitis. But if it bleeds non-spontaneously, that means it bleeds only on brushing. It's a less severe condition like gingivitis. Okay? Spontaneously means without any stimuli. It just keeps bleeding all the time, even if the patient is not doing anything to his gums. Is it clear? Is it clear, Amal? Amal, can you hear me? Okay. So let's go ahead. Uh, then you ask, is it everywhere or is it in a few teeth? Okay. This will tell you whether it is generalized or whether it is localized. See, perio can be both. It can be a generalized sensitivity if it is generalized gum condition, or it can be a localized gum condition and it can be a localized gingival recession. But there is gingival recession happening in something known as abrasion also. Abrasion is nothing but non-carious tooth surface loss. Okay, again you need to differentiate. Non-carious tooth surface loss will not have bleeding gums. It will have a cause of abrasion, like the patient will be brushing very hard. Whereas in a perio-related gingival recession, there will be bleeding gums, there will be wobbly teeth. Okay, so you need to differentiate again perio and non-carious tooth surface loss. And finally, if you think it's a perio case, gingival recession is related to perio, then you will again ask all the perio questions like before. Okay? The wobbly teeth, the spacing, the spontaneous brushing, the foul taste, and so on. So again, though it begins differently, it's a perio case. Is it clear? So the first complaint we saw was bleeding gums. Guys, can all of you hear me? Okay, great. So there can be either a bleeding gum history, or it can be a sensitivity history, or it can be a gums coming down history. And the fourth one can be the ulcers history. Yes, ulcers can also be perio related, but the chances of this coming is very, very rare. But we should not leave it, right? You should try and cover everything which can come in a DTP scenario. So when the patient is saying ulcers, it is probably either a recurrent aphthous ulcer or a squamous cell carcinoma or an anug. These are the only three ulcers which are asked in DTP. Now, recurrent aphthous ulcers and squamous cell carcinoma. Okay, okay, I'll just take the. I hope I have a pointer in this. You mean to say you mean you don't want me to mark much, right? Okay, okay, okay. I'll try doing that. I hope I find a marker. Okay, so the recurrent aphthous ulcer and the squamous cell carcinoma will be taken under ulcers, which is a separate topic. Okay. Today we'll be just talking about the perio-related ulcers, which is anug. Is it clear? And when we will be talking about ulcers in a separate topic, I will tell you how to differentiate between all these two. Today we will just talk about anug so that it's not a lot on you. Is it okay, guys? Okay. So they will, again, if it is ulcers and if you feel it is perio-related, then you will ask the same question. Since when do you have it? Is it acute? That will tell you it's acute or chronic. Is it everywhere on some places? That means it's generalized or localized. And after you have diagnosed it, that it is a perio-related ulcer, the two important questions which you will ask to identify whether it's an anug is what color it is. Okay, anug ulcer will always be yellowish gray in color. And secondly, do you have metallic taste or foul taste? The patient will say yes. So if it is yellowish ulcer, if it has gray metallic taste, it is an anug. Is it clear? And the chances of anug coming are very, very rare. Okay. Usually they will give a perio case starting with always with bleeding gums. Okay. Is it clear? Should I go ahead? The chief complaint gets over here. So at least you now have an idea that what chief complaints can be asked in perio related cases. Guys, so this is how you write. Okay, this is the way you will be writing in your DTP case sheet. You will always make sure that you divide your answers with this diagonal line. Okay, ulcers will be generalized, Amal. Okay, there will be everywhere, and the patient may say it is everywhere between my teeth because it usually occurs in the interdental areas. Okay, but the two important things you need to look for is the metallic taste and the grayish yellow color, and if that both is yes and there is bleeding gums, then it is a sure shot anug. Okay, Amal? So this is how you will write the history in your sheets. Diabetes you will write under medical history. Smoking and stress you will write under social history. Clear? Should I go ahead? So now you need to write your diagnosis, and this is the orange sheet. So in the orange sheet you will write the diagnosis here, and in this column you will write why you think it is so. Okay, so what will you write in this column? If it is a periodontitis, you will write all the complaints which the patient has told you in the blue sheet. So the best thing is to just write this, the entire thing. You can just copy paste in the reasons of provisional diagnosis. Okay, and you can add the clinical findings as well. So the history and the clinical findings have actually led you to your provisional diagnosis. Clear, guys? Great. Now let's go to how will you make the diagnosis. Now bleeding gums is probably always periodontitis or gingivitis. Okay, but it can be these three conditions as well. That is a pyogenic granuloma, an endoperio lesion, or a perioendo lesion. but the clinical history, the clinical findings will be very, very different, and this will be discussed under separate topics. So pyogenic granuloma will be uh, explained under swellings and ulcers, and endoperio will be taken under pain. Okay, but they are very different. These will obviously go in a different area or a different pattern. Probably bleeding gums will always be periodontitis or gingivitis, but always correlate the findings which they give you. Is it clear? Should I go ahead? So apart from perio, I have told you what it can be. It can be either a non-carious tooth surface loss if there is sensitivity. It can be a squamous cell carcinoma or recurrent aphthous ulcer if it is an ulcer. It can be a pyogenic granuloma, an endoperio or a perioendo lesion if there is bleeding gums as well. So you just need to differentially diagnose it by looking at the clinical findings and asking specific questions. All good to go? So when we again talk about swellings, I will again tell you about how to differentiate this from perio. When we talk about pain, I will tell you how to differentiate this from perio. So you don't need to worry about it. Today we will only stick to perio because it's a perio-based case. All good to go? Should I go ahead, guys? Any doubts still here? Okay. Now coming to diagnosis. Now you will be given some clinical findings after the blue sheets. Okay? You have to make sure that you take the findings into consideration and the history which you have, and combining both of them you arrive to your diagnosis. So let's first talk about gingivitis as the diagnosis. Your BPE scores of gingivitis will always show 2 or 1. Okay, that means it is gingivitis. And your findings will show bleeding gums. They will bleed only on brushing, and it won't be very severe, so there won't be any mobility or any sensitivity. Okay, so combining these two things, your diagnosis comes as gingivitis. Now, whether it is localized gingivitis or generalized gingivitis, this is something where everybody gets confused with. So it's quite simple. Always make sure that whenever it is more than 30% or it is